Hi, my name is Karina Littlefield, and I'm an exercise physiologist here at the Cardiovascular Disease Prevention Center. Welcome to today's education on symptom recognition. Today we'll be discussing the signs and symptoms of angina, heart attack, and stroke. Building a healthy future means responding to symptoms that may suggest you are at risk for heart attack or stroke. Often, reacting quickly is key. Together, we will discuss the warning signs in more detail and review an appropriate plan for management of any symptoms. We'll start first with an overview of angina. So angina is your heart's way of telling you that you're not getting enough oxygen via blood flow to the heart muscle. Angina is a warning sign and does not cause permanent damage to the heart. Whereas with a heart attack, there's potential for damage to the heart due to prolonged lack of oxygen. So this will be the big difference, that we'll look at when we're distinguishing between angina versus heart attack. So again, angina is that warning sign that doesn't cause permanent damage. So some signs and symptoms of angina may be chest pain, discomfort, shortness of breath, pain or numbness in the arms, the jaw, our shoulders, back, or can also be fatigue. And with angina, symptoms usually last a few minutes and may come and go. And commonly, angina symptoms can be brought on with exertion. So the first thing you want to do, if you feel your symptoms brought on, with exertion, is you want to stop and rest and see if the symptoms resolve. And also, when we're talking about angina, a lot of times you may hear the term, what we use, anginal equivalent. And this is looking at, an individual's symptoms. And typically, if they have a diagnosis of angina, you may have the same symptoms occur, with that angina. And that's when we use that term anginal equivalent. And that's what we try to help, work through and distinguish, when you're experiencing angina. And typically, if you have a diagnosis of angina, you may be prescribed nitroglycerin. So, I'll review this protocol with you and some other, reminders, if you do have a prescription of nitro. So with our nitro protocol, we'll use the example if, you exerting yourself and you start to experience your anginal symptoms. Like I said, you want to stop and rest, see if those symptoms subside. If they don't, that's when you want to go into your nitro protocol. And so the nitro protocol is, at the onset of symptoms, once you're seated and resting, you want to take one nitro, wait 5 minutes. If the symptoms continue to persist, you want to take a second nitro, wait 5 minutes, and if they're continuing to persist and you have to take a third, once it gets to the point where you have to take a third, then you also want to call 911. With that protocol, you don't want to take any more than 3 nitroglycerin within a 15-minute period. Like I said, you want to make sure you're seated. And you never want to drive yourself anywhere. Again, that's why you go right to 911. You don't want a family member driving you, to the hospital. You want a specialized team that's going to come, and assess the situation and give you that, cardiac support, in that situation. And the importance too of not taking any more than 3 is what nitroglycerin does for us. Is it acts as a vasodilator. So it's trying to find, that area of the heart that's lacking that oxygen, and that nitro is going to go in to try to vasodilate those vessels and hopefully relieve those symptoms. And as a result of that vasodilation, it's going to make our blood pressure drop. So that's, again, why you want to make sure you're seated and no more than 3. You don't want to further that dilation, and become more symptomatic. As a result, it might contribute to a really bad headache with all that dilation. So again, that protocol, is no more than 3 in 15 minutes, calling 911 if you have to take that third. And then just some other precautions, to be mindful of, if you do carry nitro, is you want to make sure you always have it with you. You don't want to leave for the day and, leave the nitro, at home on, the table. It's prescribed for a reason, so you want to make sure that you always have it with you. And something that can help with that is they make little aluminum pill carriers that have a key ring on it that you can pop the bottle in there, and that way you can clip it, on your bag, on your keys, so you always make sure you have that with you. And also what that pill case will do, it'll help protect the nitroglycerin, which once nitroglycerin is impacted by heat and light sensitivity. So keeping it, in that aluminum carrier will help protect it from that, from getting wet, different things that, can affect, the pills. And also, with that, you don't want to leave it out, on the counter at home in the sunlight. You don't want to carry it, in warm areas. For example, if we, tuck it in our pocket, that tends to be a warm area over the day, or, in the bottom of our purse. So, using that aluminum pill carrier can be very helpful, not only as a reminder to, always have your nitro with you, but also to protect, that medication. And also, one other reminder with nitro is if you do open it, it can be helpful to write down the day that you open it, record it somewhere, because you want to dispose of it 3 to 6 months after you open it. So that can be key to have that feedback available, so if it's getting too close to that time, you want to dispose of it and get a new prescription. So that sums up the topic of angina. So next, we're going to give an overview of heart attack, and help further distinguish that difference between the two. So your heart muscle needs oxygen to survive, and a heart attack occurs when the blood flow that brings oxygen to the heart muscle is reduced or cut off completely. And this happens because the coronary arteries that supply the oxygen muscle with blood flow can become narrowed from buildup of fat, cholesterol, and other substances that together are called plaque. And this slow process is known as atherosclerosis. And when the plaque within an artery breaks and a blood clot forms around the plaque, and this clot can block the blood flow through the artery to the heart muscle. And ischemia results when the heart muscle is starved for oxygen and nutrients, and when this damage or death of part of the muscle occurs as a result of the ischemia, it's called a heart attack or myocardial infarction. So again, just reviewing, the angina and the heart attack, again, that angina is that warning sign that does not cause permanent damage, whereas, with the heart attack, there's that lack of oxygenation, there's that clot, that blockage somewhere, and, over time, if it's not, getting intervened with, that's when we can run into that heart muscle damage. So, key distinguishing difference there is, again, that angina is a warning sign, versus if it's a heart attack, you want to, get the intervention quickly to help, prevent any damage to that heart muscle. So some symptoms, of heart attack vary. It's not always what you may see, in Hollywood, with, heavy chest pain and then someone, passing out. The symptoms can vary, so we'll go through those together. First being, it can have uncomfortable pressure, squeezing, fullness or pain, in the chest area, discomfort. We may have some discomfort, in one or both arms. We may have some back pain, neck, jaw, strapping pain across the shoulder blades. Stomach pain, shortness of breath, and can even see sometimes, nausea, vomiting, or lightheadedness. So you can see, a lot of symptoms can attribute to a heart attack. So when we look at, symptoms, one word that we use are what we call presenting symptoms. So what we want to review with you are what your presenting symptoms were leading up to seeking medical attention. And that can help distinguish, if you have future symptoms. We'll always kind of see, all right, are these similar to the presenting symptoms that you experienced, or are they different? and that can help distinguish symptom management moving forward. And then also, another factor that can contribute, to heart attack, like I mentioned when we were talking about angina, if your angina is not relieved after 3 nitro, then that's when you want to seek, medical attention, call 911 as well. And that's can be helpful to, know your nitro protocol, and know when the symptoms aren't resolving that you need to call 911. So, again, to wrap up, that difference, I can't reiterate enough, between angina and heart attack is, that angina is a warning sign versus the heart attack, can have that potential to cause permanent heart muscle damage. So time is critical, in these situations, so that's why we, repeatedly say, call 911, have the appropriate medical team available, versus trying to manage anything, on your own. Activities, different levels of exertion, and being able to recognize when something feels off. You know your body the best. Your heart rate, blood pressure, everything can be looking good, but you might be feeling differently. So it's really important to, develop that, self-awareness, if you are experiencing symptoms, and then in your recovery process as well, being mindful of that, whether it's your anginal equivalent, like I mentioned, or your presenting symptoms, and then distinguishing if something's off. And if something is off, you want to report it, to a medical professional. And even if it's nothing, it's better to have that awareness and, be safe than sorry. No, nothing is, wrong if you're, reporting the symptoms. Because like I said, you know your body the best. And, and then reporting those changes accordingly. And then lastly, if you do continue to experience ongoing symptoms, one tool that can be helpful is to keep a symptom log. We have one available, as a PDF on our website that you can, download and print, or if you have your own method, if you keep a journal or a notebook, it can be helpful if you're, continuously experiencing symptoms. If you have that log, it can maybe help distinguish, if there's a certain trigger that's causing these symptoms, and that can give some insight to, a better way for us to help manage these symptoms moving forward. So to wrap things up, we're going to bring some awareness to stroke, and we'll keep it simple using an acronym that we call FAST. And this stands for face, arm, speech, and time. And we'll look at each one of those letters in more detail. So starting with F for the face, if you think an individual might be having a stroke, you want to ask that individual to smile and see if that smile is symmetrical. If you notice one side tends to be a little droopy, that can be an indication that that individual might be having a stroke. Next is the A for arm. So you want to ask that individual to hold up both arms. If you notice that one arm seems heavy, or that they're not able to lift that arm up, again that can be an indication of stroke. The S for speech, you want to have that individual say a simple phrase, hi, how are you? If it seems like it's a little slurred or they're having some word finding trouble, again the speech can be an indication of stroke. And lastly is the time. If you observe any of these symptoms, you want to call 911 right away. Time is especially critical if someone might be having a stroke. The sooner they can get intervention and treatment options, the better the outcome. Typically that first 60 minutes is very critical. So, never hesitate to go right to 911, again, not driving anybody by yourself, going right to the medical professionals that, can assist with the proper resources and attend to that individual for the best outcomes. So remembering FAST, face, arm, speech, and time. Right. And that wraps up our discussion today on symptom recognition. And, again, making sure we're able to distinguish, between angina, heart attack, and then just having, that basic stroke awareness, can help in the future if you were ever able to develop symptoms, and hopefully give you, a better idea of how to, manage things appropriately. Thank you.